All right, so welcome back to the next talk, next presentation here at VAPS 2020. And I'm really glad that a good friend and colleague of mine has some time, made some time in his busy schedule to talk about a topic that's really, that he really is familiar with. So my colleague and friend, that's Les Podlog from the University of Utah. He's an associate professor there. And the topic that he's talking about is injuries. Why is Les so familiar with injuries? Les was a wrestler, a two-time All-American athlete. He was a Canadian national champion, junior national champion, and he was part of the Canadian national team in wrestling. And unfortunately, he experienced, and I just read that from the piece of paper, dislocated elbow, multiple shoulder dislocations, a hernia, fractured hand, and 3 reconstructive knee surgeries were necessary in order to get him walking again. So unfortunately, Les really experienced a lot of injuries, which led him then to deal with injuries at university, and he didn't pursue the path his doctors suggested to him to start beekeeping or basket weaving, as he told me before. And I'm really glad again that Les is part of VAPS today, and that you are talking about injuries from a sports psychological perspective. So welcome, Les, and it's great to have you here.
Yeah, thanks, Christian. It's great to be here, and yeah, thanks for the opportunity to speak at VAPS. I think it's such a great thing that you're doing. So thank you for having me. As you mentioned, I work and teach in the area of sports psychology, and I've been at the University of Utah for the past 10 years. And as you can see from my initial slide here, it's set in quite a picturesque location in the foothills of Salt Lake City, and we're really lucky to have mountains and some beautiful surroundings for recreating and being in the outdoors. So it's a great place to live and work. As you mentioned, Christian, I used to compete in amateur wrestling, and I've got a shot of myself here back in my younger days, competing against my former teammate, a fellow named Daniel Igali. And as you mentioned, I was unfortunate to have sustained numerous injuries over the course of my wrestling career. And I think for me, I often found that it was really the uncertainties. And so much of injury was not just a physical challenge, of course, of getting the leg strong or, repairing the shoulder or the damaged tissue, but really dealing with all of the uncertainties and the kind of what ifs about whether I would be able to come back and what implications the injury would have for my career. And so I really found that those psychological challenges kind of stimulated my interest and gave me the impetus to better understand the psychological challenges that other injured athletes were facing and what strategies could be implemented to help them cope with this particularly uncertain or challenging time frame. So on that note, I just want to talk a little bit today about some of the research, in particular intervention research that's been done on the psychology of sport injury. And just to give the viewers or the audience a bit of a background or sort of context for the research, there's 3 main areas that have been the focus of much of the research within this area. The first relates to the antecedents, or how injuries occur. And often people think of acute injuries as simply a matter of bad timing or being in the wrong situation at the wrong time, or bad luck, that kind of thing. But there's substantial research now to show that psychological factors can influence or increase athletes' injury risk or their vulnerability. So I'm going to talk a little bit about some of that research. Second area of research focus has been on what happens once athletes do get injured. And there's certainly substantial evidence to suggest that in the aftermath of an injury, that it can have a big psychological impact or take a psychological toll on athletes' mental health, on their thoughts and their emotions, and that psychological factors can also influence the course or the quality of athletes' recovery. So for instance, things like their motivation or their efficacy beliefs, or the extent to which they receive social support. These social and environmental or psychological factors may have a big impact on athletes' rehabilitation and finally, their return to sport. And recently, particularly over the past 15 or so years, scholars, practitioners have recognized that just because athletes are physically ready to return does not necessarily mean they're psychologically ready. And so that those two don't necessarily coincide or go hand in hand. And when I'm talking about this return to competition timeframe, I'm really focused on the timeframe when athletes are transitioning from their rehabilitation back into sport-specific training and ultimately into competition. So as I mentioned, I want to kind of highlight in particular some intervention research that has been the focus in each of these three areas or domains. But just before I do that, I'm actually going to start with the conclusion of my presentation at the very beginning. And I want to offer a few take-home messages that I'm going to get into as I work through the series of slides. And the first is to really demonstrate that psychological factors do in fact influence athletes' risk of injury, that they have an impact on their rehabilitation and on their return to sport. Secondly, I want to argue or suggest that psychological factors are very much malleable or modifiable, and they're something that we as sports psychologists can train, influence, and have an impact on. And third, I want to highlight some different monitoring tools or screens that practitioners can use to help track or monitor athletes' psychological status. So just going back to that first domain or area of research that I mentioned that looks at the precursors or the antecedents of injury. And as I mentioned, there's increasing evidence to suggest that psychological factors do play a role in injury occurrence. There was a meta-analysis conducted by Andreas Iverson, who's a leading psychology of injury researcher at Halmstad University. And he and his colleagues looked at, or they reviewed research looking at the psychological and social factors that predict injury risk, but that also may play a role in injury prevention. And just briefly, if we look at this slide here, you can see that on the left-hand column, there are the injury predictors and the relationship with injury occurrence. And the strongest relationship that they found was between what's called the stress response and injury risk. And the stress response refers to a couple components. The first relates to the attentional changes that an athlete undergoes when they experience stress. So typically under threatening or stressful situations, the individual may get distracted. And when they're not involved in the task at hand, or maybe they're thinking about a past mistake or something uncertain in the future, an outcome, they're more distracted and they're more susceptible to getting hurt. The other element of the stress response is more physical in nature. And so when athletes get stressed, there's of course physiological changes that occur within the body. Things like they fatigue quicker, their timing and coordination are reduced. Maybe their decision-making becomes impaired, or their muscles just don't function quite as effectively. And so under those conditions, it's not hard to see how the athlete may be more susceptible to getting hurt. Okay, two other factors that you can see in those correlations highlighted in red, and the second refers to daily hassles. And these are more just chronic kinds of concerns or stresses that the athlete or individual has in the course of their daily routines and their daily life. Maybe something like they're just too overwhelmed with multiple demands, or maybe they struggle just getting to practice on time, that kind of thing. And then the third area, or the third component, psychological factor, I should say, that was related to injury was negative life event stress. And these are things typically more like major life occurrences, things like getting fired from a job, separating from a significant other. And so as you can see, they found that these were sort of the strongest relationships with injury, although I should say still relatively small in terms of the size of those relationships. So typically, when we know, of course, that certain factors may be related, in this case to injury risk, then the goal of injury prevention research is to target those factors to see if intervening can have an impact in lessening or preventing the likelihood of injury occurrence. And so I just want to share a study that I think is really simple but very eloquent and powerful in terms of its results. And that was a study conducted by Andreas's former supervisor, Urban Johnson, who's also at Halmstad University, back in 2005. And Johnson and his colleagues, Mark Anderson and others, were interested in looking at whether a psychological skills intervention could be effective in reducing injury risk or vulnerability among soccer players. So what they did in this study was they sampled, they had, I think, a couple hundred athletes, but they sampled them on some of these risk factors that I was just talking about. And ultimately, they ended up with a sample of 32 soccer players who demonstrated what we refer to as a at-risk psychosocial profile. So they were high in anxiety. They reported elevated levels of life event stress. And there's also some research that shows that poor coping skills has been linked to injury. So these three factors interact to work together to what's called an at-risk profile. And they intentionally selected 32 individuals who demonstrated this profile to determine whether an intervention could be effective in reducing injury rates. They randomly assigned them to either a treatment group or a control group. The control group simply did their usual physical recovery, or usually their usual physical training. And the treatment group did their physical training, plus they got a number of psychological skills, which I'll talk a little bit about in just a second. And then they asked the coaches to report the number of injuries the players incurred over the course of their soccer season. And in terms of the intervention, the treatment group received 6 mental or psychological skills over the 19-week period of the soccer season. And these skills included things like relaxation exercises, so cognitive and somatic relaxation. They gave them goal setting. They gave them stress management techniques, so like problem and emotion focused strategies for helping them manage their stress, and a number of other psychological skills designed to help them build their confidence, their efficacy, and to regulate that stress response that I talked about earlier. And then what they did prior to any intervention, they found that they assessed all athletes, and they were all free of injury prior to the start of the study at the pre-test. And then again, they measured injury over the course of the season. And what they found at the season's end was when they compared the control group versus the treatment group, they found a total of 21 injuries across 13 players in the control group. And in the treatment group, there were only 3 injuries across 3 players. You don't even need to do a t-test to show that this is a significant difference between the 2 groups. And I think it, demonstrates the value or potential value of addressing some of these risk factors and intervening with them in an effort to try and prevent injury occurrence. Okay, so again, the value of knowing some of these risk factors is that it enables us as sports psychologists, as practitioners, of course, to intervene and to address factors that have been shown to be empirically related to injury vulnerability. Okay, so on that note, in terms of the targeting of those variables, it's useful, of course, as sports psychologists and practitioners to have some screening tools. And I mentioned one of those risk factors being anxiety. A tool that's commonly used in many behavioral health settings for assessing anxiety is called the GAD-7. And as you can see here on the screen, it has 7 items, so it's very short, it's easy to administer, and it simply asks the individual or the athlete to reflect on the last 2 weeks and how often they've had problems such as feeling nervous, anxious, or on edge, not being able to stop or control worry, so on and so forth. And in terms of the scoring or the assessment, it's really quite a user-friendly tool. As you can see here in the left-hand column, I've indicated what different scores are indicative of. So for instance, if the athlete is scoring between 0 and 5, it indicates that they have no or very low level of anxiety. And then there's some corresponding treatment actions. If we look at kind of that second row, if a score is of between 6 to 10, it suggests that the athlete may have mild anxiety levels, and then maybe the follow-on protocol or treatment is simply to watch and to see how they may respond to some different intervention. So I think the value, again, of the screening component is that it just gives us as practitioners some tools to really think about how we can monitor the athletes and get a sense of when they might need intervention or potential referral. All right, so just transitioning to that second area of research, I mentioned that there's increasing and fairly wide body now of scholarship that looks at the impact of injury on athletes' mental health and how psychological factors influence athletes' course of recovery and rehabilitation. This research is vast, and so it's hard to adequately summarize it in a single slide, but I think it's fair to say that injury certainly represents a source of uncertainty or threat for the injured athlete. There may be innumerable kinds of questions that the athlete has about the impact of the injury on their ability to once again compete, whether they'll be able to compete at the same level, whether they'll be able to achieve goals. Certainly if they're earning an income, that may be a significant source of threat or apprehension. And I think for most of us, uncertainty and threat induce anxiety. And that's certainly the case for injured athletes. There's also consistent evidence to suggest that injury represents a sense of loss for the individual. They lose a self-defining activity. They lose just the fact that they get to do something that they enjoy doing and may contribute to their sense of well-being or their sort of daily routine. They may lose connection with significant others, their coaches, their teammates. And so these forms of loss can lead to negative thoughts, emotions, or even depression. And on some level, these are all normal and appropriate responses to some form of pathology. But of course, they can become more problematic when these negative thoughts, emotions, or clinical levels of things like depression or anxiety persist over time. And so again, I think from a practical standpoint, that monitoring can be very important. And I want to just touch now on a couple studies that I think, a couple of intervention studies that I think really kind of highlight, again, the value of targeting certain psychological factors and that touch on that point about the modifiable nature and what we can do as sports psychologists or providers to help modify, enhance, or bolster athletes' psychological status. So in a recent publication, one of my longtime collaborators, Dr. John Heil, and I conducted a psychological skills intervention with rehabilitating athletes. And I'm happy to share that publication with any viewers. And essentially, our question really was, can a psychological skills intervention enhance three things? First of all, athletes' well-being or their mental health. Secondly, their adherence or their compliance with rehabilitation practitioner suggestions or the recommended treatment protocol. And third, their clinical or functional outcomes. So presumably, if they're experiencing greater well-being, they may be more engaged or more adherent to the rehabilitation program. And if that's the case, it stands to reason that their clinical or functional outcomes will be enhanced. So what we did was we recruited 16 Division I varsity athletes from the University of Utah, where I work, and 4 of them were male, 12 of them were female. I should mention it can be difficult to actively recruit, currently injured individuals, and then to engage them in a psychological skills training intervention, which I'll talk more about the details of in just a second. Part of our requirement, or a key requirement, was that these athletes needed to have an absence of at least 4 weeks from training and competition. That's an indicator, I guess, of severity. The athletes that we had enrolled experienced serious injuries, things like ACL surgeries or stress fractures. And on average, they were out of training and competition for a minimum of 12 weeks. So again, these were athletes that had pretty serious injuries. And we adopted a quasi-experimental design in which the first 8 athletes were enrolled in our experimental or treatment condition. So these athletes got their regular physical rehabilitation, plus we gave them 4 psychological skills that were based in a cognitive behavioral approach. So in a nutshell, the idea was that if we could help them how they were thinking and processing the event, that it would have an impact on their emotions and their subsequent behaviors. For example, their rehabilitation adherence. And I'm going to, on the next slide, I'm going to talk about each of these 4 skills in more detail. But just briefly, as you can see, we had injury education designed to help them minimize some of the uncertainties. We had some tools and skills focused on helping them manage emotions, pain, and to help them focus in and sort of reduce or manage some of these distracting thoughts that they might have. So that was the experimental group. Then we had 8 athletes enrolled in the control group, and these individuals simply engaged in their normal course of physical recovery, their regular sort of physical rehabilitation. Okay, I mentioned the psychological skills. And in terms of education, my colleague John Heil, who many years ago wrote one of the very first books, in fact, I think it was the first book on the psychology of sport injury with that very name. That came out in 1993. And he's, over the years, done a lot of applied work with injured athletes and been involved in research. And he developed an injury education guideline that's really intended as a heuristic to help give athletes knowledge and information to reduce some of the uncertainties associated with injury. So you can see some of the bullet points here are things like just an understanding of the anatomy of the injured area or changes caused, mechanisms by which rehabilitation may work, or things like description of diagnostic or surgical procedures, so on and so forth. The education guideline is much more extensive than what I've shown on the screen here, but this is just to give viewers a sample of what I'm talking about. And the idea was that the athlete would take the education guideline and they had sort of regularly scheduled appointments at the University Rehabilitation Center. They would meet with their treating athletic trainer. So that's a designation for the physical therapist or physiotherapist here in the US. And they would go through the bullet points and take notes, basically trying to get key take-home points that they would then come back to the intervention provider and have a discussion with them about what were the key take-home messages that they got from their discussion with the treating sport medicine provider. In terms of emotions, one of the exercises that we did to help athletes manage their negative emotions was a technique called a written emotional disclosure. And this is basically a form of documenting one's thoughts or emotions. Doing a diary might be another term. James Pennebaker developed the technique to be used with people with PTSD. And it's been shown in the case of injury to be efficacious in reducing athlete distress and actually improving their physiological functioning. So we just gave athletes some prompts or questions to consider thinking about to help them kind of frame some of their writing about their emotions. In terms of pain management, we also had a strategy, or one of the strategies that was used was some relaxation and imagery to help them manage severe or persistent pain. And then finally, as I mentioned, our fourth skill was focus and distraction control. And in this case, one of the sample exercises was simply having the individual list some of their concerns and solutions. And then we would have them think about whether there were any pros or benefits or downsides to any of the solutions they might propose. So if they said, well, I like to use, I drink heavily as a solution, then we would say, okay, well, what are some upsides or downsides to that? And then to encourage them to maybe adopt some of the solutions that had the most number of pros and the least number of cons. So it was sort of, again, this very sort of cognitive series of exercises designed to help them manage emotions and engage in positive behaviors. All right. In terms of our protocol and our measures, as I mentioned, we had we gave the athletes 4 assessments or indicators of well-being to assess their positive and negative emotions, their vitality or their energy, and their self-esteem. In terms of their clinical function, they were given an assessment called the Oswestry Disability Index. And these were measured at time 1. So time 1 occurred within 1 week of the athletes entering into the athletic training or treatment facility. Okay, so all athletes in both of the groups completed those measures at time 1. Okay, time 2 reflected the midpoint of athletes' rehabilitation. So the treating sport medicine provider indicated when the athlete would roughly be at their midpoint, and then they were given the same well-being indicator or assessments and clinical function assessments. But you can also see here, I don't know if my little red dot works on the screen, but you can see the bottom, they were also given assessment to measure their adherence. And that was done, we actually asked the treating athletic trainer to give their assessment of the athlete's adherence. So it was the sport medicine provider's perspective. And then finally, we took the same 3, we measured the same 3 indicators at time 3 when athletes were cleared to return to competition. Okay. So just to orient you a little bit to the slide here with some of our results, you can see again on our horizontal axis, we have the 3 different time points that I mentioned. Again, time 1 was when the first week of rehab, time 2, the midpoint, and time 3 when they were cleared. These are the mean or average scores for positive affect. At time 1, when they first entered into rehabilitation, there were no significant differences between the groups. So they were essentially equivalent, scoring relatively low on positive affect, which is what you would expect because they're injured and that they're at the start of their rehabilitation. But you can see that over the course of their recovery, both groups improved. But what we found was that the intervention group, represented by the dotted black lines, had significantly higher positive affect, both at the rehabilitation midpoint and upon medical clearance to return than athletes here in the control group. So again, significantly higher levels of positive affect with the treatment group. Okay, when we look at negative affect, we found a fairly similar pattern of results. Again, at time 1, no significant differences on their scores of negative affect. Over the course of recovery, both the control group and those getting the treatment decreased in terms of their negative affect, which is what you would anticipate given they're making progress and hopefully gaining strides. But we also found that in terms of negative affect, there was a significant difference at time 3 where the experimental group had significantly less negative emotions than the control group. Now, this is an interesting time point because there's evidence to show that when the athletes are cleared to return, that apprehensions and worries and fears can sometimes resurface as they're about to compete. So this is showing again that our experimental or treatment group had lower levels of negative affect, which may be a valuable thing from a practical standpoint. In terms of our vitality scores, again, this sort of reflects their level of energy or enthusiasm, so to speak. No significant differences between the groups at time 1, but we did find that both at time 2 and at time 3, that again, our athletes in the treatment group had significantly higher levels of vitality. We didn't find any differences in terms of adherence or clinical function. And we suspect that at least part of the reason for that may have been because it's important to understand the context. So these were athletes rehabilitating in a Division I university where there's a lot of kind of attention given to ensure that these athletes are showing up to their rehabilitation, that they're doing the things that they need to. There's a lot of resources and kind of support to ensure that they're there and engaged with what they're doing. So on some level, it made sense that both the athletes in the control and treatment group were quite adherent and that there weren't necessarily significant differences. But again, I think these findings do suggest that from a well-being standpoint, that there certainly is value in trying to address, potentially modify or enhance athletes' psychological status. And that when we do that, or when we provide our tools and skills, that we can help increase their well-being. All right, just very briefly, I want to just touch on one other rehabilitation intervention because I think this study is such a neat and powerful illustration of the connection of mind and body that's so critical to the injury experience. Typically, the goal of rehabilitation in the case of musculoskeletal injury is to regain muscle strength and function. And often, in looking at that, researchers have focused in particular on the role of muscle mass and its role in muscle strength and muscle function. Okay, far less attention has been given to the role of the primary motor cortex or the nervous system as a critical determinant of muscle strength or weakness and what's called voluntary activation. So voluntary activation is the nervous system's ability to act or to accurately and actively activate muscle. And it's been shown that voluntary activation is reduced or compromised following experimentally induced weakness of muscle. Okay, so what Clark and colleagues did in this study, it's quite neat. In order to sort of test or examine the role of the motor cortex as impactor or determinant of muscle strength, okay, they enrolled 29 individuals in their study and they put them 29 of the individuals who were enrolled in the study were immobilized in a cast from their wrist or from their elbow, up to their wrist, 29. Okay, they also recruited 15 healthy controls. So these were just healthy individuals who had no immobilization of their arm whatsoever. Okay, a third group was taken from that 29 that group of 29 individuals who had their arm immobilized. So of those individuals, 14 not only had the immobilization, but they were also given 5 sessions per week of imagery. And in each session, they simply imagined 52 times their muscle contracting for 5 seconds and then resting for 5 seconds. Okay, so again, there were 3 groups: the immobilization group that did no imagery, the healthy controls, and the immobilization group that did the imagery. Okay. What they did then was they measured their wrist flexor strength using a torque motor task, and they measured their voluntary activation. Again, that's the nervous system's ability to activate muscle using an electrical stimulation device. Okay, they took these measures at 3 time points. They did it at baseline prior to the 4-week experimental intervention period or period of immobilization, immediately at the end of the 4-week period, and then 1 week post-recovery. So 1 week after their casts had been taken out. All right, so if we look at this graph, I'm going to try and dissect it so it's not too confusing, or we can see again the 3 different groups. The immobilization group is represented by the open circles. The control group is the dark circles, the black circles, and the immobilization and imagery group is represented by the open triangles. And the graph here reflects their muscle strength scores. At baseline, prior to any intervention or any, before they had their arm immobilized, all the groups were equivalent. So no differences at baseline. Okay, what we can see here, if you look at the immobilization group, you can see that they had nearly a 40% reduction over the course of that 4-week period in their muscle strength. Okay? The imagery group, as represented by the triangles, also had a loss of strength, but theirs was almost half that of the control group. In other words, just the act of imagining attenuated or diminished the loss of muscle strength by almost 50%. That's a lot. Okay, if we look at the voluntary activation findings, again, a similar pattern. You can see that at baseline, all 3 groups are equivalent, but over the course of that 4-week intervention period, the immobilization group experiences approximately a 25% decrease in voluntary activation, which again, you would expect. The imagery group, however, only experienced about a 12% loss in voluntary activation. So again, it appears that just the simple act, not actually contracting anything, just the simple act of imagining oneself contracting the muscles in the arm can reduce the loss of voluntary activation. And I mean, these are powerful findings to me of the illustration between the connection of mind and body. And I think I love a study like this because it really highlights, I think, the power of sports psychology interventions in terms of actual muscle function. Great stuff, I think. All right, just to finish, a few more thoughts on that final component, or sorry, that final theme that I mentioned, which reflects the return to sport. And increasingly, whether it's an all-star athlete or athletes at high school levels, there is indication, as I mentioned, that athletes who may be physically ready aren't necessarily psychologically prepared, or that there are still steps in building athletes' confidence and their belief that they're ready to resume their competitive play. In a meta-analysis conducted by Claire Arden, she's a physiotherapist and has a strong interest in the psychology of injury. She and her colleagues have done quite a number of nice studies, in particular on the return to sport. And they did a meta-analysis, or pardon me, a systematic review and a meta-analysis looking at return to sport outcomes amongst athletes who had anterior cruciate ligament surgery. And one of the key findings from their study was that only 63% of athletes returned to their pre-injury levels, even though 85% achieved satisfactory clinical and performance outcomes. So again, this is saying that even though athletes may be physically ready, there seem to be other factors that may be at play as to why they're not necessarily returning, even though or despite the fact that they may be achieving these clinical indicators or functional indicators. And there's increasing evidence to suggest that those factors certainly are psychological in nature. One of those in particular may be their confidence to resume competitive activities. There's a scale developed by Doug Glaser back in 2009, which is probably one of the most commonly used inventories to assess athletes' psychological readiness. And as you can see, it's a fairly short 6-item inventory, and it just focuses on confidence in different areas. Things like playing with overall confidence, or the ability to play without pain, or to not concentrate on the injury, or to not focus on sort of the injured body part. This is a great tool, but I think it's also worth mentioning that as with any self-report measure, there can be self-report bias or social desirability. So certainly, the athlete who has a strong or intense desire may be somewhat clouded in their judgment and their desire to get back. And so even though, they may, have certain concerns, or maybe there's still physical things even that need to be addressed, I think it's important to be aware that, these inventories may be prone to desirability, where if the athlete thinks the practitioner is making decisions, they may say what the practitioner wants to hear, or, again, their desire to get back may say, yeah, I'm ready, even if they're not necessarily truly feeling so. That said, again, I think it's another tool that may provide some data or a conversation between athlete and practitioner. As I mentioned, that scale focuses on confidence, but just briefly, in one study back in 2015, my colleague Ross Wadey and I in the UK and a couple other colleagues suggested that maybe confidence might be an important part of what it means to be ready, but not the sum total. And so there may be other dimensions of what it means to be ready. And in this particular study, we were also interested in whether readiness is something that can be cultivated or developed. And so it was really kind of a preliminary study where we did focus groups and one-on-one interviews with 7 competitive English athletes, all of whom had severe injuries. And I'll just briefly mention the results in terms of the dimensions or components of readiness. Again, athletes did talk about confidence in their rehabilitation. So the fact that they felt like they had a good program to follow and that their rehabilitation was effective, that gave them confidence in their readiness to return. Things like confidence in their body part or in their performance capability were important. So it suggests that, confidence may be or not just unidimensional, but multidimensional in nature. But they also talked about a couple other components of readiness. And one of them that I thought was interesting was this idea of having realistic expectations. And they said that, they were aware that they might not actually perform at the same level, and that maybe part of being ready was having a realistic understanding of what level they would be competing at once they returned. So to have some expectations that were realistic or feasible. And then a third component related to that second one was, given that awareness that they might not perform at a certain level, the idea of having certain requisite level of motivation to regain those performance standards. And they realized, again, that just because they completed their rehabilitation didn't mean that they were sort of ready just to go back in and perform at a high level. So they needed a certain motivation to kind of take those steps to get back to that high performance level. So certainly, I think there is more work in terms of that third phase of research, or that time frame, to better understand what readiness is, the factors that hinder or foster its development. There is as far as I'm aware, not really any intervention research focusing particularly on the return time frame. So, we need more work in this area to better understand also what are some implications that readiness has for outcomes like re-injury or their post-injury performance, or prevention of secondary injury. And just lastly, I'm excited about some work that I'm fortunate to be doing with some colleagues at Arsenal University, where we're assessing the validity of that measure by Glaser. And we have some data looking to see whether those readiness scores predict their perception of post-injury performance. Have a nice sample of international Premier League level soccer players. So I think there's a lot of work to be done, and some exciting things, particularly in this return to competition phase. So just to conclude, this is really a reiteration of what I already mentioned, and I hope I haven't gone over time too much, Christian. But as I mentioned, hopefully I've presented this idea, I guess, that psychological factors are involved in injury risk, and I think we can track those, that they also play a role in injury rehabilitation and return to sport. I think, again, in particular, as sports psychologists, we're in a great position to work with athletes and to help modify some of these malleable psychological characteristics that, as I've talked about, can be trained in some way or enhanced to hopefully increase or decrease risk of injury, help athletes recover better, and possibly make a more effective return to sport. And then finally, as I highlighted in the discussion, there are tools. There are many more than I presented. I'm certainly happy to share with any viewers different tools for different phases of the rehabilitation. So thanks very much. Great to have the opportunity to speak, and yeah, great to be with you here, Christian. Thanks very much.
Thank you, Les, for the wonderful presentation and talking about injuries in detail there, and sharing especially the interventions. I believe that those are very important. I'd like to go through some basic questions together with you. Only very shortly, maybe 2, 3, 4 questions. And maybe I'll start with the antecedents first, and then we go to the rehabilitation, and maybe lastly to return to competition, just to follow your structure. Okay. I believe it's absolutely crucial to educate athletes about stress, about the stress response. You were talking about that in particular during your presentation, and to teach them the coping skills. Could you briefly talk about the coping skills that you consider most important in that regard when it comes to really prevent injuries, based on the research that you did? I mean, you were talking about the relaxation techniques and goal setting, etc. But I really like the study that you shared there with the 6 sessions over the 19-week period. Can you briefly talk about the necessity for those coping skills and what that really means to for athletes to prevent the occurrence of injuries?
Yeah, sure. So, yeah, good question. I guess my suggestions in terms of the kinds of coping strategies that are effective would probably mirror what some of the evidence suggests and has been shown to be effective. And as I briefly alluded to, some of the things that typically researchers have addressed are either the cognitive component of anxiety or the somatic component. Mm-hmm. And so, certainly some of the commonly employed types of interventions that sports psychologists are familiar with might be like muscle relaxation or breathing techniques to address some of the some of the somatic components mm-hmm. of that stress response. And the breathing is really important because there's so many situations outside of sport or inside of sport where the athlete needs to be able to manage particular acute stressors or, again, kind of situations in a day-to-day basis or just within the context of a performance. And so, I think things like breathing that we often take for granted as something that happens automatically can be a really powerful tool that, when practiced, can help regulate the somatic component. In terms of the cognitive component, having just some strategies to kind of help reframe the meaning of an experience. Certainly things like mindfulness, I think, are becoming increasingly popular, where individuals are simply aware of thoughts that are passing, and rather than necessarily trying to stop those thoughts from necessarily coming into your mind, because you might not be able to control it, to be aware of that internal dialogue and how it might impact things like your emotions. And that awareness in and of itself can be a useful tool just for managing it, and sometimes realizing that it's a thought, it will pass, that it doesn't have to be more magnified or intense. On that note, I think helping individuals sometimes just to regulate the intensity of the emotion, right? And so sometimes it's not just the existence of a negative thought or emotion, but the strength of it that can be really important in kind of working with the athlete to address. And that's where sometimes that awareness piece comes in, because I think a lot of times athletes are kind of, not that their stress isn't real, but that maybe they're kind of playing a role in generating their own worry. And so, sort of addressing things on those two levels, on the cognitive and also on the somatic level, I think can be beneficial for the athletes to develop those coping skills that not only may help prevent or reduce injury risk, but also, again, are important just in managing different athletic situations, right? Whether they're kind of going into a tough competition, or maybe they have like a physical test that they're worried about, whether they're getting scored or evaluated, or, there's so many situations in sport that can be challenging for the athlete.
Yeah.
I think kind of operating on those two levels can be helpful.
Yeah, I think especially the raising the awareness, the internal awareness is important, and I believe it relates to the daily hassles and the life events that you mentioned on the one hand, and at the same time to the attention that is important during the sport, maybe while I'm part of the activity, so that the attention does not change. Right. But that I'm aware of what is happening right now, and that I might be tired, that there might be some fatigue, no matter if it's during training or competition. So mindfulness, as discussed on day 3, because on day 3 we were talking about acceptance commitment therapy. So mindfulness could be one approach there also to help athletes prevent the occurrence of injuries.
Right. Well, and I think that's a great point. Certainly to that stress response that I mentioned earlier, part of that is when the athlete gets distracted, they're, maybe having task irrelevant thoughts. As I mentioned, they're, thinking about a mistake, or maybe they're thinking about someone's evaluation of them, or they're sort of thinking too far ahead. And of course, there's ample evidence to show that optimal performance typically occurs when people are present focused and present centered. And so, kind of using some of the concepts or tools of mindfulness or acceptance commitment kinds of therapies or interventions to help the athlete maintain their focus in the here and the now can be useful for minimizing distraction. And if it's the distraction that's causing the injury, then that can reduce the likelihood of injury occurrence.
Yeah, excellent. Excellent. Taking a step from there to the rehabilitation part, you were talking about the study that you and John Heil did there, and congrats on the great study, and especially on the results that you found there. I thank you for sharing your research there. I think it was really interesting that especially the well-being part was changed during your intervention there? And as you said, it's been a CBT focused intervention then there, and again focusing especially, well, obviously then on dealing with the emotions and with the problems that are present. What do you think? What was the most important part of the intervention that you did there that led to those results? Was it as I mentioned, the dealing with the emotions, or was it something different?
Yeah. So again, that's a really good question. I think one of the limitations of what we would call or refer to as a multimodal intervention, where you're employing different strategies, is that it can be very hard to tease out what's driving the effect. And so, it's hard for me to say based on the design of the study, what I think particularly might be driving these results. But, on another sort of just intuitive level, or in terms of kind of my sense of things, I think it may be a function of a few things. One, and this is where another flaw of the study comes in, or a potential issue is that of attention. And it may be that it's nothing so much specifically about the skills themselves or the content of the skills, so much as the fact that athletes in the treatment group had the benefit of interaction. They had someone meeting with them who was talking about, adding support. And there's a lot of evidence to show that social support is important for injured athletes. So I think part of what was driving the effect was the fact that these individuals were getting that support, irrespective of some of the content. Now, having said that, I still think there was some value to the specific intervention work that was done. I mentioned, I talked a little bit about the heuristic that we used, and some of the feedback from the athlete was that was really helpful in giving them a sense of a little bit more certainty over that which is unfamiliar with them. And athletes don't always have the tools, I don't think, to ask the right kinds of questions. They don't always know, what should I be asking, or can I ask questions? And so I think having something like that in guiding their interactions can be useful, because they not only get knowledge and information, but I think it does sort of give them a greater sense of this belief that I can be involved in the rehabilitation. I can ask questions. I can interact with my practitioners in a way that helps me glean information that then gives me greater understanding of what's happened to me, how I can move forward effectively. So I think that's part of the efficacy. There's, again, I mentioned some research. Didi Mankand has done some work on written emotional disclosure, and just the benefits of writing down your thoughts and really kind of putting paper, pen to paper, and how that can help cope with some of the emotions. So there may have been benefit to that. In short, I think different components may have contributed, but again, based on the design, it's very difficult to kind of tease out what, if anything in particular, was primarily driving the well-being effects that we saw.
Excellent, Wes. Thank you for that explanation. And I really think that's really valuable. I believe it really is, because what you're basically saying ultimately is that it comes down to satisfying the needs, the psychological needs of the athlete, of the injured athlete. And that is autonomy, competence, and relatedness. And with being the sports psychologist for the injured athlete, I create a relationship to the athlete, and he's able to talk about his or her needs, or simply have someone he or she is able to talk with on a regular basis. And I believe that's important, to have a certain structure in your week, and not only seeing your athletic trainer, physiotherapist, or coach, but also to have someone who guides your thoughts. And then, as you just mentioned, guide my thoughts and use my competencies. So satisfying the second need, You already know what needs to be done in your process. I'm only here to help you identify that, and then having the autonomy to really do exactly that, what I really need. So ultimately, it comes down to satisfying the psychological needs of autonomy, competence, and relatedness. Is that correct?
Well, yeah, and certainly I didn't explicitly refer to some of those concepts, but in a number of studies that I've done or been involved with, we've tested some of these principles of self-determination theory, or this need satisfaction theory that looks at the potential value of what happens when you make athletes or individuals feel competent or capable, and give them a sense of control or a sense that they're sort of determining the course of their actions, and when you help them feel connected. And we've found, increasing evidence to support the value of satisfying those three needs, as you refer to, in athletes, and that it has beneficial properties for their well-being or their engagement in the adherence. To the piece about autonomy, I think, some might say really the goal of rehabilitation is to give the athletes some self-regulation skills, or to help them, self-manage their injuries. And that as treatment providers, we're trying to help facilitate, or, the sports psychologist or the physiotherapist or sport medicine physician is only interacting with the athlete a certain portion of the day. And so the athlete, what are they doing when they're away from the training facility, when they're at home, or what kinds of behaviors are they doing? And so I think, to the point about the autonomy, if we can give the athlete some tools and skills to help them self-manage, self-regulate, all the better.
Yeah, right. And last point to the rehabilitation part. Thank you for the great study. I didn't remember the authors about
Brian Clark.
Yeah, thank you. About the intervention on the motor cortex. Yeah, using the imagery.
Yeah.
I think that's a very valuable neat study, as you said, because it simply shows the efficacy of sports psychology in a very precise context. And thank you, on a personal note, thank you for sharing that, because it's exactly what I'm doing in a different way with one athlete at the moment. And his task is to imagine that he's walking, because he injured his right knee, and he had a surgery, and he was immobilized, and we're working on exactly that.
Right.
We can't measure that in the very end if it's helping or not, but after today, I'm 100% convinced that it's helping.
Yeah.
So thank you for that. Yeah.
I would just say on that note, I think especially if you're like when interacting either with an athlete or maybe sort of a sport medicine provider who's very oriented in a kind of biological model or approach, that I think these kinds of studies are valuable in demonstrating the efficacy of, again, some of the tools and strategies we would employ in the world of sports psychology. And, it's nice when you can say, well, it's not just sort of, oh, you're going through this exercise and it's sort of like, yeah, that, sounds like it's nice and, may help me feel better, but what are the concrete sort of tangible benefits of it? And I think that's a great illustration of that, and maybe makes what we're doing a little bit more enticing, or people are potentially more receptive.
Absolutely. And what I want to underscore there is that this athlete, he told his physiotherapist what he's doing there, that he's simply imagining that he's walking. And interestingly, his physiotherapist said, well, you don't really need to do that. We do all the work here, and everything that we do here, that will make you feel better afterwards, whatever. And I think that's a very important point, having those studies ready to work. And I think that's important together, to cooperate together with healthcare providers, whoever that is ultimately, and to show them, well, it might be beneficial for at least some athletes, and if it might be beneficial for some, we should need it more, use it more, apply it more.
Yeah. And one other thought on that, Christian. So I've had conversations recently with high performance athletes at the very highest level. And in one interview or discussion in particular, one of these individuals was talking about NHL hockey player, Stanley Cup winner, talking about how he used imagery in particular, not just when he was injured, but regularly, to put himself in certain situations and to imagine himself performing or executing like he wanted to, talking about in particular how he used that with injury and helped him come back after a season where he had 30 to 40 shoulder dislocations and then had a shoulder operation and then came back and, you know, eventually won the Stanley Cup. And so, you know, like, it's not just, I think the combination of sometimes having individuals in high performance and at the top level saying, I use it and it works, then maybe other people are likely to believe. But in addition to some of those maybe more anecdotal forms of evidence, to have, I think, studies like the one by Clark and colleagues again is beneficial. So
yeah, great. And that's where we really combine theory and practice, and that's the beauty of that. Great. One last question regarding the return to competition part. I mean, as you said, it's quite difficult. It's a quite difficult area. There's not a lot of research on that. Maybe we could encourage more sports psychologists who are working in practice to talk about what are they doing in exactly that period of time when athletes are going back into their competition. The question you raised is about the readiness. How do I realize if I'm ready or if I'm not ready? And you were talking about the confidence, the realistic expectations, and the motivation part. What would you say, just based on your personal experience, maybe as an athlete, maybe in sports psychology, I have no idea. Based on your personal experience, what would you say, when is an athlete really ready? What needs to be present for an athlete to really say, yes, I am ready to go back to competition?
Well, I wish I had a great answer.
I know it's a difficult question.
Good answer to that question. I mean, I think that's one of the things I'm very much interested in better understanding. And as I say, in kind of carrying out more work. I mean, certainly, or, you know, maybe this is fairly obvious or evident, you know, of course, sport is a physical thing. And I think, like, for many athletes, they talk about, you know, psychological confidence coming from physically being able to do certain things. And I think it's important for sure that athletes, you know, often, as we've discussed recently, you know, for many athletes, there's a primary focus on time. And in some ways that can do a disservice to the athlete because they're so focused on, well, you know, the sport medicine provider said 8 months, I have that number in mind, and I'm going to try and push it back 2 months, or if they said 8, I'm going to do it in 7 because I'm going to be one of those effective recovers. And while I think, you know, it's a fine line because you want, of course, athletes to apply the same skill set, the motivation, and all the things that they employ during their usual training to their rehabilitation. But there's also that point where maybe, particularly in the case of a long-term or severe injury, where that desire could be tempered a little bit, or, you know, better to maybe err on the side of being a little bit more cautious. So, you know, to your question, I think there may be, I think kind of one thing that's really important are, rather than maybe asking athletes sort of these more direct questions that are subject to social desirability, that there may be other observational kinds of things. So as a sports psychologist or as the coach, things like, does the athlete seem hesitant from what I observe in terms of their play? So maybe there's behavioral kind of indicators of, well, they look like they're tenacious going into certain situations. Or I notice, just from my impression, is they seem very apprehensive going into circumstances that may be similar to how they got concussed in the first place. So kind of observations, I guess. Maybe it could be sort of more indirect things, like just asking the athlete how they're, to what extent they're interested in engaging in certain things. Like, do we want to try this today? So you're not directly asking them about, do you feel ready? But you're just like, what are your thoughts about maybe doing this series of twisting, like some sport specific skill or task in a high performance or maybe even potentially threatening kind of performance like environment. And if they say, yeah, like that would be great kind of thing, then maybe that's sort of an indicator of readiness. On the other hand, if they seem more ambivalent, maybe that's also a sign that, well, maybe they're less ready to return. And so I guess what I'm suggesting is maybe there's more indirect forms of observation, given my sense that I think, many athletes are so keen to get back. This is what they've been working hard for. And so, sometimes maybe just asking them directly, my sense increasingly is, I don't know if that's the way to go. But it's still an issue, an area of interest, because I think to me, it would be exciting, just as we have clinical and functional indicators of, okay, your strength, your proprioception, your endurance, you pass all these tests on the presumption that if you do so, you're going to be ready. Well, if we had an equivalent kind of battery of maybe direct or indirect assessments or observations to that are validated, and that we can say, okay, these have been shown to, if you score this on this indicator, you're less likely to get re-injured or more likely to, whatever the outcome of interest might be, then I think in a few years, I might be better positioned to answer that question. But I think it's an area that definitely needs more work.
Maybe, thank you for your question thank you for your answer on that difficult question. Maybe that's exactly, again, one more point that we could focus on in research, developing such an observational screening instrument that we could use and apply in such settings. Yeah,
definitely. I think it's something of interest, something that I'm trying to work on with various colleagues at the moment and pursue as well. But I think, again, to me, given that athletes have invested potentially a lot of physical, mental, energy in their recovery, if we are better positioned to assess your question, when are they really ready? Or there's always probably some uncertainty, but if we can maybe reduce some of that a little bit and have some clear indicators, I think that's great, right? Like from an athlete standpoint, from a team or organizational standpoint, they of course want the athlete to come back healthy and be able to resume their play at a high level. So
yeah. And unfortunately, at the same time, coaches want them to perform well. And sometimes they pressure their athletes to come back early just because they need them. But that's a different question, different area of work we have to do there.
Well, yeah. And I think also, of course, as sports psychologists, we play a role to some extent in trying to help the athlete manage those external pressures or environmental circumstances that they're returning in. And, I guess all too often, I think as sports psychologists, we tend to just focus on the individual athlete, but of course there's the whole context that they're competing in. And, I think helping them to manage those interactions with others or the environment can be a useful thing or role that we can maybe assume.
Yeah, absolutely. Les, thank you so much for your time and to your insights and sharing your knowledge, your experience in the area of injuries, and especially talking about potential interventions that other sports psychologists can do with injured athletes to help them comeback after an injury. Thank you so much for your time.
Great to be with you, and thanks for the chance to present at VAPS.
Thank you. Have a good day, Les.
Thanks. You too, Christian.